And we will also record today, just to let you know, so feel free to pop yourselves, turn your cameras off if you don't want to appear on the recording. Next slide, please, Peter. As always, lovely to see lots of familiar names on the call today, and great to see some new ones too. Thank you for taking the time out of your day to join us. And for those that don't know us, a short summary about who we are. So we are Get Berkshire Active, the active partnership for Berkshire, one of 42 nationally. So more or less, if you went to another county or region, you would find an equivalent to us. And we know that movement is the foundation of good health, well-being and thriving sustainable communities. But right now, movement and physical activity isn't accessible to everyone in our county. And so we are working to change that, and we want to help everyone to move more. We work with a whole range of partners to do that, to help create the conditions to support people to be more active. Okay, next slide, please. Apologies if you've joined one of our webinars before, you will have seen the next couple of slides, but always a good reminder for why we're here today. So the Live Longer Better Revolution was founded by Samur Gray about 5-6 years ago, and it's all about supporting our ageing populations to do just that, live longer better. And we want to increase health span or healthy life expectancy and decrease that period of dependency, therefore reducing the need for health and social care. Next slide, please, Peter. And so we now know that ageing is a normal set of biological processes which don't actually cause major problems till individuals are in their 90s. Most people, however, confuse ageing with the combined effect of ageing and loss of fitness. And so this graph attempts to summarise 2 phases in life, a phase of growth and development, and then a turning point. And unfortunately, it's all downhill from there. That turning point, which for a lot of people is in their 20s, sometimes earlier, usually coincides with maybe when you get your kind of first job or your first car, essentially spend more of your time being more sedentary, and a fitness gap opens up between the best possible rate of decline and the actual rate of decline. The best possible level is shown by those who have kept active. But what we know from the research is that many of the problems that we have assumed as being due to ageing, for example, decreasing strength, an inability to look after yourself, or some stiffness, poor mobility, are due not primarily to ageing, but to loss of fitness. The good news is you can actually close that gap at any age, but the more you are affected by the ageing process, the longer it can take. So essentially, it's better not to lose it in the first place. Inactivity affects people the more they're affected by the ageing process. You need to move more each year. So when our Live Longer Better webinars is all about trying to help kind of talk about ways that we can close that gap, share knowledge and resources. And so, yeah, if you want to talk more about this with us after today's event, please don't hesitate to get in touch. Next slide, please. So as I mentioned, I can't quite believe it, but this is our 10th Live Longer webinar now. We've been delivering them for 4 years. You will find all of the there's a mixture of presentations and recordings on our website from all the previous events, so we can share the link to that in the follow-up email. And you can also see there that we've covered a whole range of topics. We couldn't have done this without our hugely knowledgeable and generous speakers, which leads me nicely onto introducing today's speakers. Next slide, please. Thanks. So our first speaker is Peter Dutton, the Senior Engagement Manager for the Richmond group of charities, who are a coalition of 15 leading health and care charities working to support people with multiple and long-term health conditions. Peter's role focuses on influencing policy and practice with a priority on physical activity. Peter has led on the Richmond Group's behaviour change campaign, We Are Undefeatable, inspiring people with health conditions to move more through real life stories and practical resources. During today's webinar, we've also got speakers from 2 Berkshire-based organisations who are going to provide that kind of local case study perspective. The first will be Debbie. Debbie Medlin is the founder of Movability, a social enterprise that is dedicated to ensuring exercise is accessible to everyone. Movability's inclusive seated chair exercise classes delivered both online and on site help clients, including those living with long-term health conditions, to achieve a better quality of life through physical movement and through the social benefit of building a sense of belonging. Then we're going to have some colleagues from Maidenhead United Football Community Trust. Helen is the trust manager, where she's been a driving force since the charity's inception, and with over 16 years of experience as a sports development manager at the Royal Borough of Windsor and Maidenhead, Helen brings a deep understanding of community health and wellbeing. As well as managing the trust, she spends some of her time coordinating and leading wellbeing walks and is a qualified athletics coach and run leader. She's joined by Angela, who, after a successful career in business development, followed her calling to support others more directly, retraining as a mental health coach and launching her own wellbeing business. For the past 2.5 years, Angela has been the wellbeing manager at Maidenhead United FC Community Trust and working to support the health of the local community. Helen and Angela will be joined by one of their long-standing participants, Tony, who joined the Wellbeing Walks back in 2023. And I'm sure we all look forward to hearing more about his story. So we've got a jam-packed programme of speakers. I'm going to do my bit to keep to time, and we'll pass to our first speaker, Peter.
Thank you very much, Kirsty, and yeah, thank you for having me today, and also to the speakers who are joining us. You're going to be stuck with me for a little while until we bring in those brilliant case studies that both Movability and Maidenhead United FC Community Trust will be talking through shortly. But yeah, I'm Pete. I am the Senior Engagement Manager for the Richmond Group of Charities, as Kirsty mentioned, and you can see the charities that the coalition behind the Richmond Group represent there, some of which you may be connected with or have an awareness of from a national point of view or a local perspective as well. And yeah, today we're going to focus on how to support the least active people with health conditions to move more, of which there's plenty of overlap with older people in terms of, as we age, the likelihood of increasing one or multiple long-term health conditions increases as we age. So there's plenty of overlap with the Live Longer Better movement, and something that we've been supporting with many different active partnerships across England in the last couple of years. So in terms of what we're going to cover today, we're going to do a quick warm-up activity. Then we're going to do a bit of a session focusing really in on the latest insights on the least active people living with health conditions. We'll go through some of our We're Undefeatable resources to help older people to move more. And then we'll bring in our Berkshire case studies that we've just talked through, and then we'll go back to Kirsty and team to wrap up the session. So, as you said, lots to get into, plenty of chance for sort of engagement and chat throughout as well. So we'll open up to discussions, or we'll bring use of the chat as you've just been doing to introduce yourselves throughout, so we can really get some nice feedback along the way too. So hopefully strap yourselves in. It's going to be a good hour or so of content that we can get through. The first bit's probably the most dry bit, talking you through the insights, but it's also the bit that really helps to set the scene. So I'll be starting with that. But before we go into that, I just really wanted to get a feel from you with a quick activity in the chat, basically to let us know which of these on the tree, which of these numbers that you can see on the tree represents how you feel about supporting older people living with health conditions to be active currently. So if you're a 10, you're in the middle with your arms open. It might be that you're towards the bottom and just starting this journey. You might be a 20 at the very top, and you're doing this day in, day out. It's your bread and butter. So if you can use the chat to just give us a number, and we'll start to get a feel for where you're at and how you feel about supporting older people living with long-term health conditions to be active. So fire away, which numbers represent you? We're getting some through. We've got a 4 from Steve. So at the bottom, but looking positively upwards, I think that one, Steve. Ali, good to see you on the call. I can see that you're an 11, which is sort of arms around the number 12, so about halfway up the tree, but doing it alongside other people, which feels quite nice and collaborative. Got a few other 11s and 12s, which is good. Charlene's given us a 20, top of the tree. I love that, Charlene. We've got Katie who's given us a 15 there. So yeah, towards the top of the tree, arms in the air, positive about how it's feeling. So it doesn't look like we've got many 5s or those that look like we're sort of struggling in this space. Elaine's given us a 5. So I guess this is quite a new concept for that. 21, yeah, that's an interesting one. That's someone sat arms crossed. It's like they've got there, but they're not happy about being there. I'm not sure about 21 really. If you're that far up the tree, I hope you're more of a 20 than a 21. But for those who are at the bottom end of it, I guess the idea is that we're going to be sharing insights. We're going to be sharing learning throughout today, that may help you to increase that and to sort of help you to feel better about how we can support people with long-term health conditions to be active based on the lived experience insights that we'll be sharing next, but then also from the amazing case studies that we'll have further down the line as well. So thank you for that. Just a quick warm-up one to get everyone in the mood and thinking about how we support people to move more. So really quick introduction, but Kirsty's done a fab job of this already. But this is the Richmond Group, is that coalition of 15 health and social care charities who work together to support people with multiple and long-term health conditions. We do this by using our collective voice and influence in policy and practice, both on a national and local level. And we do have a priority and a programme around physical activity, which is where I sit within the Richmond Group. And born out of that is a campaign called We Are Undefeatable, and that's our campaign to support and inspire people living with long-term health conditions to be active. So hopefully that's something that you've seen over recent years. It's been 6 years in the making. Our sister campaign is This Girl Can, so it's another Sport England funded campaign. And the idea is that it's led by a cast of real-life storytellers, and it's underpinned by a bank of resources and tools that we'll talk through later that can help not just inspire people to move more, but begin that journey to being active too. So the best way to tell you what We're Undefeatable is all about is to share one of our campaign stories. So I'm going to share John's story now.
And I thought, no, I'm going to do as much as I can. Yeah. Well,
So that's a little bit about what We're Undefeatable is all about. Hopefully that's some you might have seen John's story or some of our other stories before. We've got over 25 campaign stories that cover a host of different conditions of people from different backgrounds, different groups, taking part in different activities, moving more in a way that works for them. And that's the whole idea. And I guess there's a whole piece around the power of storytelling that We're Undefeatable focuses on, and how we take that lived experience storytelling forward, rather than, I guess, how we may normally tell case studies and stories, which might be that, you know, John is taking part in our program and this is how we're helping him. Everything you'll feel there is from John's point of view, his challenges, his diagnosis, how he manages things in day-to-day life, but then really importantly, how the physical activity or the movement supports him. And you can really see it in John's story. It's why I wanted to share it today, because as soon as he does kick a football, his shuffling reduces, his movement starts to get better. And it's a real clear example of then how we can inspire other people living with Parkinson's and other neurological conditions to be active. So that's the whole part of We're Undefeatable and what it's all about. But one big part of what we do have as a campaign is that we create a whole host of insights and research from continuous tracking of the campaign over many years. And the idea is that we pull together the lived experience insights of people living with long-term health conditions. So we can then share that with other professionals, with networks, to then influence how we may then take that forward to better support people. So this latest insight that I'm going to be talking through today, if you've heard me talk before through some of our campaign insights, this is hot off the press, so I won't be repeating anything you might have heard before. And the idea is that we want to help to reduce health inequalities and to support those who need it most. So to do that, we need to focus on those who are currently inactive within our sample. So we're going to really focus in on the inactive people within our sample of people living with long-term health conditions, because collectively they're the people that we need to support to then improve those health outcomes, to reduce the pressures on the NHS system, all of the different benefits that we know that physical activity can bring. And this may mean reaching a relatively untapped audience within sport, communities, physical activity, leisure, whatever that is. And if we can understand their needs better, then it can help us to tweak our approaches in how we can support people to move more too. So to get started, I guess to set the scene, we know that inactivity levels increase with age and thus widening health inequalities for older people with health conditions. So you can see that inactivity levels for those from 50 to 59 up to 70 plus increases significantly, and that increases further for people living with long-term health conditions too. So if you're living with a long-term health condition, you're twice as likely to be inactive than someone not living with a long-term health condition. And I just shared some of the quotes from people with lived experience on what they've been sharing with us. And what we do know is that inactivity rates are also higher amongst those from lower socioeconomic groups, with multiple and the most severe conditions too. So this is quite an in-depth graph, this one, but I guess the idea is to say that we know that different societal factors, different where people live is a bit of a postcode lottery in terms of their ability to be active, and that's showcased through this. So we know that those in more deprived areas from lower socioeconomic groups are less likely to be active. People living with one health condition are twice as likely to be inactive, but then if you're living with one or more or multiple health conditions, even more likely to be inactive, and so on and so forth. And especially those as well who say that they are living with the most severe long-term health conditions. So those who rate their condition self-reported in terms of condition severity as 7 to 10, that's 45% who are inactive. So it's quite this is setting the scene as to why we want to really support people with complex needs and to support people with health conditions to move more, whether that's a multitude of these factors overlaying or bringing it all together. So what I wanted to quickly introduce is the COM-B model, which is a theory of behaviour change that can be used to understand the drivers and context which influence how likely someone is to do something such as become more active. So it comprises of 3 interacting components as depicted in this figure. So the idea is that a person needs to have sufficient levels of each component, the capability, the opportunity and the motivation, which can then lead to someone changing their behaviour, and in this sense around physical activity. So capability is around how capable people feel to be active, whether that's physiologically or psychologically. Opportunity focuses on how much people think they have the opportunity in terms of physical and social opportunities to be active. And then motivation is how motivated people are to be active, and having equal measures of that or little bits of all of that helps us to then change our behaviour. And this is a lot of what the campaign has been built upon, and that Sport England research has brought us to following this COM-B model, even though you might be aware of some other behaviour change models like the trans-theoretical theory for behaviour change, for example, all of which can help us to identify different opportunities, challenges, barriers that people with long-term health conditions face. So when we're looking at capability and motivation, these are the greatest barriers for those who are inactive compared to those who are active living with a long-term health condition. So within these samples, what you'll see is in the red or the pinky colour is active people with long-term health conditions compared to the blue, which is inactive people living with long-term health conditions. And as I mentioned earlier, that's the audience that we really want to support. So capability barriers come out as the strongest all of the time, really, when we're looking at our total sample of people living with long-term health conditions. But as you can see, 78% compared to 64% from inactive to active say that capability, so their ability to be more active based on their physical or psychological needs, is the thing that is stopping them from being active. Motivation is 69, so kind of similar, and opportunity is actually less so. So people who are inactive with long-term health conditions actually say that opportunity barriers are less. So they may feel like they have more of the opportunity, but it's probably the capability barriers that are actually stopping them from moving more. So what I'm going to go through now is what some of those barriers are and what they look like. So you can see that there's certain barriers that over-index substantially for inactive people with health conditions. But what we do tend to see is that the top three, for example, I'm too tired, I don't have enough energy, is a reason for inactivity. My health issues cause pain. So pain is always the top barrier that we see across all of our insight and research for people with health conditions. My condition is unpredictable. Motivation comes in at fourth. I worry about overexertion due to my health conditions. I have other commitments. But what you'll see is that a lot of these actually focus on a person's capability barriers. So things like pain and unpredictability of their condition. There's some around, I'm worried about making my health issues worse. So a lot of these come in and they focus around overexertion. They focus around people worrying or concerned or having a barrier that relates to their capability to be active, so their physical capabilities, which can likely be due to impairments to the condition itself, how it presents itself within the symptoms of particular or multiple long-term health conditions too. But what you can see is that things like pain over-indexes hugely compared to our total sample. So 47% saying that they are living in pain and that is a barrier for them to be active. So it's quite a stark reality for this audience in terms of their ability to move more. And then when we look at the main barriers for inactive and active people, they're very similar, but they are greater for inactive people. So you can see that out of the top 5 barriers, 4 of them match for inactive people living with health conditions, but 4 out of those 5 relate to a person's perceived capability, as we talked about before. So only one of those where they say that I'm not motivated enough, that's only one of the top 5 barriers. All of the rest relate to a person's physical capability to move more. However, what we do know is that the desire among those who are inactive to be more active is actually at an all-time high. So I guess this is why we need to think about why, as a campaign, we want to inspire people to be more active, why we want to showcase people living with long-term health conditions can be active in a way that works for them, in a relatable way that represents their community, their condition, and makes people feel heard about how they can move more. Because, as you can see, 81% of those would like to be more active, and 78% of those who are inactive actually say that they want to be more active. So it's then, how can we address these barriers that we're talking through? How, as a collective system or individuals or organizations, can we then work to better support people to move more in a person-centered way that considers their barriers, that makes things that are tailored or that are social and supportive for that person to move more, and to get them started on that sort of ladder of being more active and moving more. And on the flip side, we also asked for what the top 4 ideas for inactive and inactive people living with long-term health conditions are. So if we focus on the right-hand side, looking at those who are inactive, we hear that things like online workouts that are suitable for people to do at home come out clear. Getting advice on what physical activity to do with a long-term health condition comes next. Having a personalised action plan and goal is also really important for inactive people with health conditions. Good local options for activities. So I presume lots of you and all the great services and activities and sessions that you will see in your communities or that you may provide yourselves is also really important. And combining physical activity with a social element also comes out on top for this group. So the idea of sharing this is that when we understand the barriers and then also what the ideas or what motivates people to move more, then we can start to help tailor and support people to do exactly that. So when we look next at more from like a healthcare professional angle, I've seen some people in the chat earlier saying that they're coming from a healthcare background or a healthcare setting. So welcome to today. And what I wanted to do was share some of our insights around the interaction with healthcare professionals too. And something that's quite stark is that inactive people with long-term health conditions are less likely to speak to or even visit some healthcare professionals. So the proportion of those who said that they've spoken to or visited any of the following healthcare professionals in the last month, you can see that inactive people with health conditions, less than half of them said that they've spoken to a GP, 30% a nurse, 30% a specialist, less have said that they're likely to see a pharmacist. But the reason that we share this is that there's actually so much there that engagement can happen from a physical activity point of view. So healthcare professionals, we can see, are really engaged and connecting with people with long-term health conditions. And some other research that we delivered a couple of years ago shown us that the NHS, GPs and healthcare professionals are actually the most trusted sources of physical activity information and advice across the system, even more so than our physical activity and sport providers, who probably have specific qualifications around health conditions, knowledge, background, understanding of physical activity and long-term conditions. But the trust still remains with the person who's, I guess, responsible for that person's care. So whether that's a GP, a nurse, a specialist. So it's then thinking about how can we support and engage with healthcare professionals to think about their interactions from a inspiring and supporting people on their journey to being more active when they're living with a long-term health condition. And the reason for that is that what we know is that the proportion who discussed physical activity with a healthcare professional, for our total sample, our usual sample is around sort of 50%. But actually, healthcare professionals from our research are less likely to discuss physical activity with inactive people. So only 32% of the inactive population said that they've spoken to a healthcare professional about moving more, which is a third, which is a good amount, I guess. But I guess what it does show is there's still 60+% to reach where we can have more engagement from the healthcare system in supporting people with health conditions to be active. And there's a slight disparity, and it may be that inactive people are presenting with more complex needs. But I think if a person is inactive and living with a long-term health condition, that is a prime audience that our professionals, whether it's healthcare professionals or not, should be looking to support inactive people to move more. And the reason for that is on the right-hand side. The impact of those healthcare professional conversations is huge. So, for example, 23%, so almost a quarter of 1 in 4 people who said they've had a conversation about being more active with a healthcare professional actually took action to become more physically active afterwards, which is huge if you think about the comparisons to other interventions like smoking cessation, which can be a much higher percentage than that. The impact of having a physical activity conversation from a healthcare professional, having almost 1 in 4, can inspire those inactive people to be more active. But the interesting bit is actually the middle bar that you can see where it says it made me think about being more physically active. And actually 51%, so over half of people said that after they've had a conversation with a healthcare professional, it made them think about being more active. And that's the really important part in terms of a person's behavior change journey, because inactive people might not quite be ready to move more. They may be starting to think about it. And actually having that conversation has then enabled them to think more about being physically active. And we always talk about sort of how that can plant a seed in someone's mind. It might not be that they walk out the door and they're active straight away, or they've been signposted or referred to a particular service. But we know that it could be something that they continue to do. They might go and gather information or take some action, speak to family and friends about being more active. And then they're more likely to move along that behavior change journey. So really important thing to share in terms of the impact and the importance of our healthcare professionals when we're supporting people to be active. And then the final bit, which sort of summarizes a lot of this and brings a lot of it together in terms of 5 key themes for supporting people with health conditions to move more. So this is an accumulation of some of our own research from our Bridging the Gap consultation, but then also Easier to Be Active consultation, which is from Sheffield Hallam University a year before our own. And where we asked people with health conditions to suggest how they could be supported to be more physically active. And the guiding principles or the themes that were brought out from that is that things should be tailored. So activities that meet individual needs and preferences. We heard that earlier when people with health conditions told us about personalized goals and that can support them with their physical activity. Accessibility, so frictionless online and offline ways for people to be active. So not always thinking about digital offers, but also what community offers are, how we can support people to move more from the comfort of their own home, going for a walk, whatever that may be. Then we've got healthcare input, which I've just talked through. So the importance and the impact of that professional encouragement that then links people to local advice and pathways that may not be the healthcare professional's responsibility to go and deliver that intervention, but what their knowledge and awareness of what's going on locally, for example, across Berkshire or even smaller places within Berkshire, is really important because we know the impact of how trusted they are in that space. Social, so fostering peer support is really important. Role modeling and group experiences that people can enjoy together, it comes out really important, and again was something in the ideas that come through earlier. And it's probably no surprise that things like affordability, so trying to reduce costs or cost barriers to activity is important, but not the most important, which I think can sometimes be a bit of a misconception, because as we heard earlier, a lot of the barriers to activity for this audience actually focus around their capability to move more and how we can better support them to be active. So when we look at these through that COM-B lens, you've got capability that links to things like activities being tailored. We need accessible opportunities for people to be active, and for people to have gone through their accessibility and tried to make it suitable for people living with one or multiple long-term health conditions. Having the healthcare input relates to a person's capability and also probably a little bit of motivation for them to be active too. The social aspect is a huge motivator and actually helps people engage and adhere to physical activity. And then affordable opportunities, of course, links to that element of COM-B. So what I wanted to do is first of all just pause for breath and see if there's any sort of general reflections, really, whether you want to have a share of some thoughts in the chat, or if you'd like to come off mute and ask a question or add to this part of the discussion. There's a couple of ideas that I wanted to share just as sort of prompts for this, but thinking about the insights that we've just shared, is there any initial thoughts and reflections from you and in terms of any key takeaways that may be useful for you, or is there anything that's new or surprising? How do these insights relate to your role or organizational strategies? And how could these insights be utilized in practice? So I hope I'm saying your name right. I've got Corrine Evans. I don't know if you want to come off, Corrine. Don't know if you're on mute, Corrine, if you want to.
Sorry.
Here we go.
I'm not very good at Teams. I'm more familiar with Zoom, so I couldn't find the unmute button. I'm here now.
You've done a good job. One
of my initial thoughts is it's really hard to get in there with primary care healthcare professionals. The work I've done, I've been working and doing sort of a big research project with Portsmouth and the NHS, and one of the things that we needed to do was have for a funded program, and one of the things that we needed to do was get referrals from local GP surgeries, and the thing that I found was it in Berkshire, so much of it is really fractured and really difficult to joined up to be able to actually get be in front of the right people. And in fact, I actually did something for Buckinghamshire. I did a presentation for all of the social prescribers and wellbeing people that work in the primary healthcare facilities, and it just feels like you're throwing a stone into a pond, and you just get no reaction at all, and it's trying to build a relationship with those people, and I really struggle to know how to do that.
Yeah, that's a really good reflection, and it won't be any surprise to probably yourself or anyone else on the call that that's not the first time we've heard that, and it probably won't be the last. But there are some fantastic things that are going on that can, I guess, help to move that conversation along. I've been in the same boat. I used to manage a GP referral program in Hackney, and I tried to knock on 44 GP surgeries doors and got into some, but didn't get into them all, or didn't get the amount of time that some gave to us to do that. I guess there's a little bit about that persistence and bringing your offer to people. I also think, and I don't have all the answers, but I think there's a question that I would always play back to a system like, I guess, how Berkshire Active can work with partners and stakeholders to support this kind of thing. But how can we position ourselves as a sector, as a system, to then support healthcare professionals better? So can we do a better job of role modeling what we do? Can we share more patient stories back to the healthcare professionals to say, here's someone who's been through this program, this is the impact on them and the support that and hear it from them. And I think that goes back to the storytelling point I mentioned before. We can sometimes fall into a trap, and I've been there because I've had funded programs before, of we helped Pete through our program because Pete did this and he attended this many sessions and he lost X amount of weight and has increased his physical activity levels by 1 day a week. Funders love that because it's data, it's what they need. But actually, I think there's so much more we can do from a storytelling point of view to really bring some of this to life. What does it mean to Peter? And I don't know why I'm using myself in third tense. But what does it mean to me? Why is it impacting me? How's it impacted other people in the community who are coming to your sessions or the different open water stuff that you do? Is there a way that we can tell that story in a different way to inspire people? And that's something that we can share some learning around. I'm not saying that's the end result, because there's going to be so many different ways that you can engage with that system, and maybe some other doors to open before getting to healthcare professionals. But I think certainly from a storytelling point of view, it's something that has come up before, and I think is something that we could do more of to share back to healthcare professionals exactly why, but from the patient's perspective or from the person with lived experience perspective. So I don't know if that's helpful, Corinne. I'm not saying that's the
really
absolute
helpful
answer, but
yeah, thank you. That's really helpful. I mean, the one thing we did have is we'd already done a pilot, and we had loads of videos of patients' feedback and responses and everything. It's still, it's just trying to get people to open your messages sometimes, or actually click on and watch a video. And
absolutely. And the other thing that does come through, and again, it's the hardest thing to find, and Kirsty may have good examples of this, or where they've struggled with the same thing. But if you can find a particularly interested healthcare professional, GP, or someone within that network, that is a real gem to a local system, because they can just open so many doors and role model it themselves, whether that's them being active or how they're supporting other people to be active. Again, I don't know the answer to that. It might be something that you've all been trying to do for many years across your system, but there will be someone out there, and if you can role model that and get the healthcare professionals to role model that, there's certainly an opportunity to do that. So yeah, I know there's another hand up. Thank you, Corinne. That was a great point. I've got Amanda. Your hand's up. Sorry, you've been waiting a little while, Amanda.
That's all right. Hi. Yeah, so I work in primary care. I'm a social prescriber. And yeah, this is really great. I mean, I'm often emailing Kirsty about different groups. So probably everybody that I speak to absolutely would benefit from physical activity and improving their physical activity. I was thinking along the lines of, when you were talking about maybe we have a health and wellbeing board in the waiting room. I could have something up there to say, do you want to improve your physical health? And these are some of the benefits to that. And then book in with myself, and obviously, you know, and get them and have that chat with the GP as well. Most of the GPs here are really good, I would say, as well, at promoting physical health. So one of the GPs was in earlier. I've got a call after this for a gentleman, and this is one of my problems now. So this gentleman had heart issues and is overweight and has got arthritis. He wants to move more. He's willing to pay, which we don't often get, but he's willing to pay. But what he needs is that sort of specialised, a cardio type, not cardio, cardiology, cardiac sort of specialist training session, and one where he feels comfortable. So maybe not just going to a gym and having a bit of personal training. A lot of the programs in our area that support people with various conditions have stopped for some funding issues at the moment, or are on pause. So I'm going to struggle, to be honest, to find somewhere for him to go, really. And I probably will email Kirsty to sort of say, I don't know where to signpost this chap to. So that's one. And then there's another one, you know, that I'm going out to see today, who she doesn't move at all at home. She just potters because she's in a lot of pain with her back. She would benefit from some exercise, but for her, she's quite negative. And so there's the motivation side, I suppose, or seeing the barriers all the time. So, you know, there's all these sort of different situations that, you know, I find quite challenging as a social prescriber. So for me, I suppose the more groups that I'm aware of that I can signpost people to, the better. But also it might be trying to run some sort of program, maybe at the surgery, where we have a GP and myself, and, you know, we can invite people along, I don't know, to maybe talk about various specialised groups. But yeah, it's just, it's great. I love, you know, these sorts of calls and meetings are fantastic, because for me, I just need the evidence, the stories that I can tell people, because I think that does start to ignite some hope and some sort of motivation with people. And the places to signpost people onto, you know, that will really help me, and I think I can then sort of, you know, signpost the right people to the right exercise groups and things. So yeah, sorry, I haven't probably made much sense. I just
you've made a lot of sense, and actually you've told a story from your own perspective in terms of the challenges that you may face in supporting people to move more across a range of different things. I know Kirsty's already popped in the chat, drop an email and follow up with maybe some of the opportunities or ways that Get Berkshire Active can support. I also think it's a benefit of having these groups and community practices, because people can connect. So there might be things that Amanda's mentioned there where others can help with their own services or knowledge of services locally. But I think the main takeaway, Amanda, is that actually you're being really person focused. You're thinking about the person and their needs in every opportunity and every story that you've just told there. Even though there might not be quite an answer or a particular service that fully meets that need, you are exploring that to try and make sure that it's personalised and is supportive of that person with the long-term health condition and whatever their preferences are, their needs, and that's what's going to better support them to be active. So I think that's a really good flag. And again, we don't always have the answers to this stuff, but I think by being here, by connecting with others, by connecting with Kirsty and team, it may then open doors to better support those people to move more. So really appreciate you sharing that, Amanda, because that's something that is certainly a challenge that many people are facing, especially when they don't have the qualifications or the background in supporting people to be active. Then that's where the gap can be, also from a healthcare professional's point of view. So yeah, it's a really great reflection. So thank you for that. We got Tracy, you got your hand up next. You're on mute, Tracy. There we go.
There we go. So I work in sheltered housing. Can you hear me?
We can.
Yep. So I work in sheltered housing. I look after 11 sites and I do the activities and events. None of our sites do exercises on site. one of our sites, which is an extra care scheme, I was doing, it was just following a CD, move it or lose it. That got stopped. I'm not qualified, but I used to do a disclaimer. And I have spoke to Kirsty, I think before. It's the funding from us. We don't have the funding, and then when we look at doing active facilities or activities, sorry, it's it's how many people would turn up. If it's a regular thing and people knew about it, then obviously they would. But it's how I can, like the lady said before, come into these forums and listening to people and getting ideas, getting more contacts. How I can, because so many of our tenants, we have a very diverse range of tenants, 55 and upwards, mobility issues, health and well-being issues. We have drug and alcohol misuse as well. We have community social lounges. We've got the facilities. It's just we don't have any form of exercises within our schemes. So hence why I've joined this forum. I've had to dip in and out because people keep knocking on the door. But yeah, hence why that's why I've joined the forum today, is to try and get some information, because people are asking for it. People are asking for some form of exercise, and we all know if you do exercise, it's good for your health and well-being. It will help with the mental health, of which we have, as I said, lots of tenants with mental health issues. So it's like a vicious circle, really. I'm just going around I'm trying to get people to come in, but it's just I'm not really going anywhere or getting anywhere because of resource. Lots of people haven't got the resource, and obviously the funding as well. So I just wanted to sort of give a little eye opener into what I do and how challenging it can be. As I said, 55 to up to 100 years old, some of our tenants. When I was doing it at the extra care scheme, the tenants there loved it. I used to get at least 12 people coming every week. Some people were going to talking to their GP when they've got health issues and saying, they were asking them, do you do exercises? And they used to say yes. And they said, that's excellent. It was fun. It was just a fun thing to do. And it got people talking, moving. And some of those tenants used to carry it on in their own flats, because sheltered housing is independent living. So people can come and go. They can use community facilities. I do put the Get Berkshire Active posters in all of our schemes every month. I don't know if anybody ever turns up for any of those. We don't do any analysis on them, but the information is there if people need it. And there's also a few other charities as well, where I think it was man versus fat, is it? I think I've just put that one up recently as well. So I'm just here really to get some information, maybe some links. Maybe someone can help me, please.
We'll definitely be able to do that, and you've actually set me up perfectly for the next part of my session, Tracy. But what I will say is, and I think this is because we've had some really honest and open reflections there, and really appreciate that, is that it sounds like everyone is doing their absolute best currently to promote physical activity, to bring it into those spaces, because you know the benefits and you know the impact and the power of them. So first of all, be kind to yourself, because you're really knocking the door, you're really trying to do all of that. And I guess definitely connecting up with Kirsty and all of the different options that are going on locally, and offers that they'll be aware of from a local provider perspective. But then what I will do is share some of we're undefeatable resources that are universal offers and resources next, which may be stuff that you can implement into some of those spaces that you can bring to life within the housing spaces, or that people could self-guide and use themselves too. I'm also monitoring the chat and not being able to read and talk at the same time, because there's just no way of me being able to do that. But there's also lots of really good stuff going in the chat as well. So thank you for that. And hopefully this next bit is really valuable for you, because I'm going to spend a little bit of time talking about our resources next. And what we aren't saying is this is the be all and end all, but we do have a whole bank of resources that can help people with health conditions to be active. And there might be some that work, there might be some that people like and don't like, There might be some that work better for you than other people on this call. But the idea is that we've been funded to create these resources so that those who don't have the ability to display positive physical activity imagery or to support people and create their own resources and assets, then the campaign can help to do that. So really broadly, the campaign has our website, which is the home to all of our We're Undefeatable stories, assets, imagery, resources that can help people to get active and to move more. So the stories you can see on the screen there. Then we've got our ways to move pages, which is all around inspiring people, how to get started with some hints and tips. Then that links out to different resources and tools from within there. And some of those include, we've got a quiz, which helps provide a tailored journey based on a person's preferences and needs. You can see at the minute, we're on the resources and workouts page. So there's lots of follow along workouts that people can do that can be plugged in on TVs if you want to display it, or that people can follow along on phones or tablets. We've got all of our campaign stories, health condition specific pages that were developed by our charity partners using their insights and expertise. So there's an arthritis and MSK conditions one on screen now. The follow along workouts are all hosted on YouTube. So they're there, they're live. We've got some lovely ones that have been, we have ambassadors like Bill Bailey and Gok Wan that are fun and take people through a 5-minute workout. We've got 5 and 5, which is a 5-minute customizable workout that people can do themselves and can follow along, especially from places like homes or sheltered accommodation. And there's just so much more on there. So what I would say is to have a look at the website and familiarize yourself with some of those resources. The other thing that we do have is a pool of all of our external resources and offers as well, that we're not the only people in this space who are supporting people to move more. There's so much other great assets and resources out there that are helping people to be active too. So I'll pop a link in the chat shortly to the main campaign website. And I'm not saying, as I said, that this is everything that's going to be useful for everyone, but there's hopefully something there that's universal that people can follow, that's ready to go. It's trusted because it's backed by our charity partners who represent many of the information and advice around long-term health conditions. And they've been brought together through the campaign's agency. So they're high quality, and all of the online workouts, all of the different activities have been created by people who are level 4 instructors. So they're specialist instructors who can support people to move more. And with that in mind, if we think about the top 5 ideas that would help people with long-term health conditions to move more, which we shared earlier, we have online workouts, getting active, getting advice on physical activity to do with my condition, personalized action plans and goals, combining physical activity with a social element. We've been listening to this research over the last few years, and we've actually created a We're Undefeatable app that has launched only just a couple of months ago, which is all about supporting people to move more, which bases on all of these and takes all of this sort of ideas forward and brings it to life. So here's Jat to give you a bit of information. You can also scan for more information here as well. So you can embed that within systems and places that you're working in. You can promote it on your own channels or share it with people to explore themselves, which might be a nice intro for it. But the idea is that it's free, convenient and tailored, and it brings together all of those different aspects that we've just covered in terms of it's suitable to do at home. It's got activity guidance based on people's conditions. You can put goals and you can work towards achieving those. There's a social element where you can join group sessions with other people online, so you can have that peer support whilst you're going through the movements. I can also see Ali, lovely to see you, Ali. She's put some health fact sheets that some of our charity partners have actually been engaged with as well. So please do have a look at those that have gone in the chat, because they're also a really useful resource. So with the app, I guess the idea is that It provides unlimited access to on-demand tailored exercise programs, and it's completely free. So our funding covers the subscription for these. There's a comms pack QR code if people do want to promote this on the screen there. And it's been co-designed and brought together with Good Boost, who are an award-winning tech provider who've won lots of awards for their pool-based health and physical activity program, which now we're bringing to life. I guess not in the pool is the best way to say it. It's been ORCA approved, so that means that it's basically had the stamp of approval for delivering safe digital health programs. It's available in 7 of the most spoken languages in the UK, and there's all of those assets to access and reach. And in terms of the stats, within our live user testing period earlier this year, 74% of app users were actually older people. So sometimes there's a bit of a misconception about the accessibility for digital programs and offers. And we know that it's not going to be suitable for everyone, as we say, but we do know that actually based on the data so far, almost 3/4 of people were actually older people who were accessing it. 20% were 70 plus as well, showing that it is accessible for this sort of live longer, better and older audience. So please do have a little look through it. We are getting some lovely feedback about what people are saying about the app when they're using it. Carol's just got it. Great work, Carol. I like that. It's also a good way to do it in terms of download it yourself, have a play, have a think, and then you might be aware to see which people that you're working with that this could work for. But you can see here that people are saying that it's tailored for them. They do hybrid working, so it's convenient for them. Gentle exercises to help me move more. The way we're positioning it is it's very much for people at the beginning of that journey. It's for encouraging people to move more, and once they've got more confident and built this in and built maybe some regularity into that by using the app, it may be then that they're more ready to go and access community spaces. But at the same time, it might be that they're joining a program once a week, and actually the app could be really useful around that on other days of the week. So we're not saying this is the biggest and best offer out there, but what we are saying is that it can hopefully support you in helping people to move more through that system. We've also got a sofa resource and workout, which was all brought together by the fantastic Bill Bailey, which inspires people to move more from the comfort of their own sofa. I won't play the video, but you can have a look at that afterwards because he's brilliant. We've got our 5 and 5 workout, which can be downloaded and printed so people can follow along. A minute each exercise and create a quick 5-minute workout that they can follow, again, very much for people who are starting on their physical activity journey. But it's not just about doing the activity, it's also with this resource, you're seeing it, you're learning it. So then there's that sort of physical activity literacy point of view that's being brought together by using the resource. We've got all of our amazing stories, and many of them feature older people living with a range of health conditions. So you can see here that we've got different storytellers, all from different backgrounds and places across England, with different conditions or multiple conditions, and all taking part in a range of activities that are featured within that as well, which is a great way to role model that people living with long-term health conditions can be active. And that's something that the campaign has shown over many years, that it's relatable, but also that it's helped changing the narrative around physical activity for people with health conditions. And just when you didn't think there was any more resources, there is. We've also got our campaign hub, which is all around supporting professionals as well. So we have a range of ready-made universal resources that can be leveraged. So you may not have the assets or the resources to help promote positive physical activity for people with health conditions. And we've got a whole host of things like assets, posters, leaflets, information packs for different audiences. We've got a whole series of all of our insights that you can access if you want to take a deeper dive after today's session. We've got a latest from us page, which helps keep you up to date on all the latest developments for the campaign. And I think that's a really good place to start. So if you can go to the campaign hub and sign up to the newsletter, you'll always be kept up to date with the latest developments of the campaign and what we're up to try and help our audience to move more. So again, definitely sign up to the campaign hub and the newsletter. We don't bombard with newsletters. We're not one of those once a week ones. It's quite rare or quite infrequent, but we do it when there's something important to update you on. So hopefully that's something that's useful for you. And just as we're wrapping up this section, got a couple more slides, and I promise that will be the last of my voice for today. We also have a very sort of, it's a non-rocket science way of telling a we're undefeatable story. So John's story earlier looks amazing. It's been brought together brilliantly, but you can do this for free. You can do this yourselves with the amazing people that you'll be supporting to be more active. So how to create a we're undefeatable story is quite easy. They introduce themselves, you find out a little bit about their condition and any personal history that might be relevant too. Again, trying to create those connections to an emotional aspect that might inspire people to think about themselves in a physical activity point of view. We find out about the challenges of living with their health condition, which is really important because it's actually those shared challenges that people connect on that makes it relatable. I'm living with a similar condition, or I'm experiencing breathlessness just like this person is. That helps to really role model then physical activity for that group. Sharing ways that that person then is more active and how they're moving more in a range of different ways in a positive way. And then, of course, how it's supporting them to be more active. Not necessarily how you're supporting them, as we mentioned before, but also how them being more active is actually helping them to move more, because that's the important story to tell that people want to hear from. It's the lived experience of others. And then we usually finish on a nice positive note, like John was making a joke at the end of his story that we shared earlier. So as I say, it's not really rocket science, but it's a way, hopefully a bit of a framework that people can take away to follow through. And the last little bit is we've been doing some work at Place in Lancashire, and what we wanted to share today was just some of the key principles for storytelling at Place, because what I've shared with you so far has been around the key principles from a national perspective, but we can go an extra layer and inspire people even more so when we do it in the places and spaces that represent them. So local storytellers and local places are always going to be more relatable. So my story, I'm from the Northwest, I'm living in Bedfordshire. My story might not connect as well in Berkshire than someone who's a Berkshire resident all their life. They've been engaged in local communities. They're part of the makeup and the network in that space. So that's a really important thing to take away. If you can showcase those local places or even the activities that you're involved with, that's also a great thing to do. Be data driven. So can you target different audiences based on the local data of where people are? This is more from a campaign perspective, but we know that if there's particular communities that represent, let's say, the South Asian population, then a storyteller from that background is going to connect more so with that population. So it's representative of them and it's relatable to them. Stakeholder engagement, everything that Get Berkshire Active are doing today in connecting that is really important. And the reason for that is point number 5 is that you can connect inspiration to opportunity. So you can share John's story and then say, here's all the amazing places where you can take part in walking football across Berkshire. And it's linking that inspiration to then an opportunity, which we can't really do as a national campaign, but you can within your communities because you can role model your own activities and services. So it's bringing that story forward and then saying, and here's where you can get involved. And that's the bit that can really connect that inspiration to opportunity. And try as best we can, we've covered it in depth, but empowering healthcare professionals with practical resources that they can use and embed. Make it easy for them if you can, because as we heard from Amanda earlier, it can be really tricky. They've got a million and one other things to be thinking of when they're supporting people to be active, or not to be active, I should say. They're thinking about other things to do with that person's health condition or journey. So if we can make it easier for them, then that's even better to do that. And then the final bit linked to the storytelling piece is that we have a resource that you can use, you can download, that is completely free, and you can add your own logos or your own information on there. So there's on our campaign hub a social media template, so you can take a picture. We've got Darlene on this one, who's one of our national storytellers, but that could be a picture of me, Pete's story, and then how I'm being more active and what I'm doing locally to be more active. I could add the Get Berkshire Active logo in there in the bottom corner, and then that's ready to go, something that you can use as a great way to encourage people to access your services, to tell the stories of your your fantastic participants and members, to then promote positive physical activity and inspire other people like them to get involved in your sessions. So there's different templates. There's one that tells the story. There's also one that then actually you can just use as a way to signpost people to any offers and services and activities that you have too. So definitely give that a go. If you're looking for something that's ready-made, ready to go, all you need to do is edit, tweak the wording, add your logo, and Bob's your uncle, you're ready to go. So that is it from me at this stage. I just want to say a big thank you for your time, your contributions. The chat's been popping off all the way through. I'm going to have a good read through of that next. But what I am going to do now is bring forward the main event, which is our local Berkshire case studies, because this is where really you and the case studies that we're bringing forward here today bring all of what I've been talking through to life. They're doing this on the ground, supporting people to be active in a range of different ways. So really pleased to have Debbie from Movability, who will be talking through the first bit. And then we also have Angela and Helen from Maidenhead United Community Trust as well, who'll be coming in shortly. So over to you, Debbie.
Thank you. Don't quite know how to follow that. Very good. I'm really impressed with the storytelling templates as well. That's fantastic. Got so many stories to tell, and it will be really good to have a place to put them. So thank you for that. That's great. Yeah. So you've got my slides, haven't you? Yeah, there we go. Right. Okay. So thank you for inviting me here today, and thank you for allowing me to share some of what Movability do, and I hope that we sort of align to the 5 sort of key themes that you've mentioned. What we really focus on, so Movability, I'm the founder of Movability, founded interestingly in COVID. Great demand for online classes, big classes, and interestingly, those classes still keep going. We really target people that are unable to access exercise, that are housebound, and just want to be able to access exercise. So we really do focus on the people that really need them. Do you want to go on to the next slide? I don't quite know how we do this. Thank you. So some of the challenges that we find here is, like you spoke about, is engaging the most inactive people. Very often they're isolated, they're intimidated by going to a gym or a local place, and they feel that they can't exercise. You know, they don't have that confidence to do any kind of exercise. And what we try and do, our target is to focus on this group of people, to give them that belief, to make them feel that they belong, that they actually can. And it starts a long way before the exercise. You know, it's just encouraging people to even think about exercising. Yeah, do you want to move on to the next slide? So what we do, Movability, we do a series that we do online classes, we focus on on-site classes as well. How we work is everything is set to each individual person. We have group classes, but everybody is treated as an individual in those classes. We encourage some people to go mad, go crazy at the class. You know, if we've got somebody that is, so our age range at one class can be from 40, I'll talk about Hannah later, we're 40, right up to sort of 98. I think our eldest participants celebrated their 100th birthday. But at the same class, we will make sure that there is something for everybody at that class, encouraging people to go at their own pace, giving them that feeling of belonging and removing the barriers so that they don't feel that they're intimidated to do that. Making the classes accessible to them, so there's no financial pressures. If people can't afford the classes, don't worry, we will sort that out for them. Classes are free, and we make it easy to join as well. So we give everybody the opportunity. You don't have to block book, you don't have to commit to come to 6 weeks at a time or 8 weeks at a time. If you come along to one class and you can't come along for 4 weeks or 6 weeks, you're welcome every single time. Next slide. This was the interesting one. Corinne, you mentioned about the challenges of trying to get the health professionals, trying to get GPs, social prescribers, to help to the funding, everything else. It is one of our biggest challenges to do that. The one thing that we have found that does work, we do engage with quite a few social prescribers, and Amanda, I found it quite interesting that also as a social prescriber you have challenges of matching people. The thing that we found over the years is that our clients are our best advocates to the doctors and to the social prescribers. Clients are going back and their GPs, their health people are noticing the difference. They're asking them, what have you been doing? You're so much more flexible. What have you been doing? Your breathing is better. So when your clients start to engage with their health professionals, then the health professionals are coming to you saying, oh, I've just seen Betty and it's amazing. And we're finding that really helps to overcome that. We are on the Joy app. So if anybody's heard of the Joy app, that's a great place. We do get referrals coming through that as well. And I think somebody mentioned as well about knowing an insider. My partner's actually a GP. That's been really helpful. So if you do know somebody within the health profession that can also help to get, it's such a valuable resource, and once you start to get known, that really does help. So what have I got here? Can we go on to the healthcare input? Yeah, sorry. So our instructors, as well as being fully qualified, one of the things we look for in our instructors is we make sure, all our instructors have just got a passion. We love helping older people. Most of our clients are elder people, and we just have a real passion. We love to hear their stories and just to encourage them and foster them in every single way. Haven't really talked much about exercise. So on this slide here, you can see this is a series of our participants. We have the lovely Hannah. She's a stroke victim. Hannah went through a really tough time. It took her a long time to come to us. I think I had about 7 or 8 emails with her back and forth before she actually came to a class. So one thing that we do is we work really hard behind the scenes and encouraging people to just come along. Don't do any exercise, come along, just come along and have a cup of tea and see what you feel afterwards. Hannah is amazing. We've got a video of her on our website. We've got Bev, carpal tunnel. When she came to us, she couldn't even move her hands at all. And she now doesn't even bring her stick. She couldn't walk without her stick, and now she doesn't bring her stick. So we find that our clients kind of speak for us. So once we get the client, once the clients are on board and they come back and they say, we don't really like exercise, but actually you're making it fun. We're really enjoying this. And of course, they like the cup of tea and the biscuit afterwards. We work with Charities. So we work with Parkinson's UK. That's me standing there. We do a fortnightly class for people with Parkinson's, funded through Parkinson's UK. Funding's quite challenging, but yeah, I'll talk about that a bit later. What else? Hang on, I'm just looking at this. Yeah, so we just try and foster this confidence in people and encourage them to be part of a social belonging. Next slide, please. Am I going too quickly? I'm not quite sure. So going on to the social side of the classes, one thing that we found is if you've got somebody that has got a health condition, they're in pain, they don't feel that they can move, they don't want to get out, it's how can you make them feel part of something? And that's not always through exercise, that's not always through them coming along, feeling the pressure, thinking they've got to get it right. And that is one of the biggest fears of people with health conditions, is that they're going to get it wrong, they're not going to be able to do it, they're going to look silly in front of people, and it's really trying to overcome that. We focus a lot on sort of the social side of our classes and motivating people, bringing people together. And one thing we found is we do have a social cuppa and chat. So after every single one of our classes, we have a 30-minute, we call it our social cafe. Everybody will stop, everybody will sit, they have a cuppa, they have a biscuit. Even if they don't want a cuppa or a biscuit, we still encourage them to stay and just to feel part of that magic. That's where we really start to build things. That we put here, that's where the magic really starts to happen. And somebody might come along. We've had it quite a lot. Somebody will come along to our class, they will sit at the back, they won't do very much, they just sit and watch everybody else, they stay for the social afterwards, and they just start to open out. And we do encourage people, come along to the class. You don't have to do any exercise, you do whatever you want to do. If you want to have a sing-along, you have a sing-along. If you just want to watch everybody else doing that, that's what you do. Peer support we find is a really valuable thing. So as well as us supporting our clients start to support each other. And that's what we find really, really beneficial to a lot of our clients. They start to support each other, and they also want to support us as well. It kind of gives them a sense of being valued. And I think people with health conditions, people that are struggling with isolation, as soon as you give them that opportunity to feel that they're doing something worthwhile, the rest just kind of falls into place and starts to happen. I'm trying to think of an example of this. So we have a lady at one of our classes who came with her friend. They were best friends, same birthdays. Sadly, her friend passed away. We encouraged her. We kept in contact with her. So a lot of what we do is really a lot of hand-holding. Gradually, she came back to the classes, and now she is such an active part of our group. She helps, she gets up, she makes the cup of teas for everybody, and she really feels now that she's part of a family. Yeah, so we're targeting loneliness, and I think with this group, you know, with the health conditions, loneliness is a really big factor in all this. You can see one of our instructors here. So one thing that we're doing, obviously we do the exercise classes, but one thing that we're doing is we decided, what can we do to bring this big community together? And we've decided to do a big movability Christmas lunch event. We have currently got about 80 to 100 of our participants coming along to a free Christmas lunch event. So we've decided that we will provide all of our clients with a free Christmas lunch and a chance to socialise. It's really bringing the whole community together. People are coming to the class and they're talking about it and what can we do. And what we find is, as they start to do this, they start to become more mobile and more active, and they start to take part in the exercises more, and they want to come back each week because they want to find out what's going on and who's done what and everything else. It's just such a really, I don't know, I can't say, it's just really, really rewarding for us to see. Yeah, so the power of connection. We joke at our classes, we often say that people come along just to enjoy the social gathering. So I think when somebody is looking at, you know, starting out, or what service do you go to, it's great to look at resources and look at what you can do online as well, but looking at the overall big social picture and the social benefit of the classes as well. We just see ourselves as a vital lifeline to a lot of these people. We do classes, we do online classes for people that are housebound, people that don't live in an area that they can get to a class. Again, they've been a really valuable resource. we provide a hand-holding service. So if anybody is struggling to access a class, we offer them technical support. We found out it takes about 8 times of contacting somebody. Once they've got that little seed planted, you talked about the percentage of people that speak to their GP and then they actually don't, some of them take action, some of them don't take action. But when that little seed is planted, it tends to take about, I think I did some research, and it tends to take about 8 to 10 times of somebody having that seed watered and let that seed grow before they actually will take action. And I think that's something that Movability are really good at, is we just keep watering those little seeds until they actually will come along to a class or take action. And then the rest kind of does itself. Can we move on to the next slide, please?
Yes, Debbie, just because I've got a stick, and this sounds really hypocritical coming from me who had an hour to chat through, but we've got to bring in our next case study shortly. So if you could wrap up the next bit in about the next minute or so, just so I can stick to my times, that would be great. Thank you.
Yeah, I knew I would do this.
No, you've done a great job.
Okay, so yeah, we talked about affordable and accessible. Funding is really challenging. We're very innovative with our fundraising, paragliding, all sorts of things, seeking funding, and just keeping that, the community feeling going. And we encourage all of our participants as well to be active, to take part in. They bring in raffle donations and everything. Conclusion, right? Okay, let me conclude. So I just wanted to say thank you to everybody. I hope it's become quite apparent that what we do is we try to foster that sense of belonging. So I think the exercise is kind of our machine for bringing that social element together, and engaging the most inactive people. Have I run out of time?
You've done a wonderful job of it, Debbie, and I love how you link that through to all of those themes that we've talked through. So thank you so much for that. Please share any information in the chat as well. If you've got links that people can find out a little bit more from, I'm sure there'll be lots of questions that people may want to ask of you as well. So yes, thank you very much. That was fantastic. What I am going to do is bring in our next case study from Maidenhead United Community Trust. We've probably got about 10 minutes for this, and then 10 minutes for Kirsty because we want to make sure we finish on time for everybody. But just another big thank you to Debbie for about Movability there. That was fantastic. So I'm now handing over to Helen and Angela. Are you there for us?
Yes, I am. And I've got Tony next to me. I think Angela's on another screen. So we'll be as quick as we can. So hello everyone, I'm Helen Preedy, Community Trust Manager at Maidenhead United Community Trust. I'm going to give you a quick short background on the charity. Angela will give you some information on a new project that we've just been successful with, linked to the learnings of recent years. And Tony, who's one of our regular participants, will be doing a quick Q&A with me, and then I will summarise our learnings to date. So Maidenhead United Community Trust is the charity arm of Maidenhead United, linked to the club's National League or National League South status now. Over a number of years, we've been able to access funding to help us kind of engage with the local community, as well as other external funding. The club and trust have a great presence in the local area. We've got over 60 junior teams, women and girls development, futsal, academy, walking football, as well as a very robust schools and school holiday programme, alongside the strong communication with our supporters and local businesses. The front of shirt sponsor we have is CALM, the campaign against living miserably, and this is a theme we use to highlight we are really there for our community in contacting with them. The community trust itself offers a range of activities, so it does the Ramblers wellbeing programme, walk leader programme, various seated and standing exercise sessions, including a back to walk programme and a back to exercise programme and a carer specific programme. We also do walking football, XLSC, which is a men's weight loss programme using football, and autism-friendly pan-disability and disability walking football sessions, along with some other events that we work with partners in the local community with, like the Ageing Expo, Women and Girls Week and International Disability Day. The club, an example of the role we have, and just to kind of link it back to what Angela's going to be talking to you about, the club and trust responded quickly to COVID back about 5-6 years ago now, working with our networks to quickly bring together 180 DBS coaches, not just from the club itself, but from other sports clubs in the local area, to helpline for shopping and prescriptions. And linked to the success of that, we were able to bring some funding down through the NHS and local council to run a wellbeing programme, which we recruited volunteers to support people coming back out of hospital, back into the community, and also a preventative strand of that to support people with a life change at that time. So maybe coming back from illness, bereavement, separation, loss of job, for instance, and supporting them at that critical point of their life through activity and connection to support their long-term health outcomes. The funding sadly came to an end at the start of this year. We're really proud of the work we did to date, and we've got an impact report which we'll have on the last slide, which we can share with you. But we have been really successful in accessing networks and professionals. I know someone earlier mentioned about linking with people, so that project really gave us a position with people like social prescribing and falls clinics, for instance, in terms of referral. And so using those learnings, we wrote this new project, which Angela, my colleague, is going to share with you.
If I put my mic on. Hi everyone, good afternoon. So we're really proud to be part of this Get Berkshire Active network, so thank you for inviting us. So as Helen said, I'm Angela, I'm the Wellbeing Manager at Maidenhead United, part of the Community Trust. So our focus is on helping people live longer and better by reducing isolation, encouraging their activity and improving their wellbeing. So we're delighted to announce the launch of our new befriending service called Magpie Meetups. And this is a new befriending service designed to bring people together, build confidence and create sort of stronger, healthier, happy communities. And a big thank you for our funding from the Heathrow Community Trust. So this project builds on the success of the Trust's previous wellbeing initiatives, which Helen's already mentioned, and it aims to reduce isolation by connecting people, particularly those aged 60 and above, through small volunteer-led social groups. So each group will include 2 volunteers facilitating up to 8 participants, and they'll meet regularly at local venues to enjoy conversation, companionship and the chance to get involved in other community activities. It can give them a pathway to other opportunities, be it within the trust or other activity partners, should they want to get involved. So linked to the nature of this project, we have a big emphasis on using local cafes, community meeting locations for the groups to meet regularly, and for the teams to promote these. Leisure centres and community centres, especially where we already have a lot of well-established relationships through our existing networks. So as I said, we already have established networks in terms of partners in the community who we've worked with before or who've referred to us through the previous wellbeing programme. So we have a huge network of people, families, supporters, those involved with the football club that we can communicate and support and help identify both new volunteers and participants for these groups. So we already have participants involved in an activity that we know are looking for more connectivity, and maybe they're looking to have a more intimate group, a smaller group. So there are quite a lot of coffee mornings and different things out there for people, but this is looking at a smaller group, so maybe somebody might be a bit more nervous to walk into a big group, and these are facilitated, as I said, by the volunteers. We already have a great group of volunteers from our previous work and that we know and trust to support this project, and they have the suitable skills around befriending to help launch this. So the main beneficiary, as I said, of the programme will be for the over 60s and adults who need connection, as well as mainstream adults who make up our existing volunteer offering, or new volunteers we will recruit to support during the project. So the aim would be to build our volunteer team further and have the capacity to facilitate more and more groups as the demand increases, as well as to be able to utilise the volunteers to support the promotion of the programme across the community. So the project will be a person-centred project meeting the evolving needs of the participants and volunteers, who will be able to adapt and continually get feedback to evolve the project so that we can embed this into the community offering. And this is also a great way to support awareness and recruitment for other activities that the Trust may run for this age group, supporting the health and well-being of the audience. And as a knock-on effect of this, it will support families of referrals to support their family members, feel supported and connected, and therefore increase independence for a longer time. So we already have 3 pilot sessions, 2 of which are starting this week on Cookham, Maidenhead and Northern Farm, which is also Maidenhead. So they're looking positive. We've already got people ready and set to go this week. So overall, the lasting impact will be a positive, more connected and supporting members of the community for both the participants and the volunteers supporting them. We'd love you to promote this to any questions you have or want to know any more about it. All our details will be on the last slide. Thank you for your time today.
So thanks, Angela. So I'd just like to introduce Tony. So Tony Simmons, who I see every Monday morning when we do our Ramblers Wellbeing Walk. Anthony, I think you're happy for me to say you're 80.
Yeah.
Retired. Your previous role until 2010 was acoustic ceiling engineer. Currently, it's the president of the local philatelic society. Hobbies include photography, computers, ancestry, crosswords and puzzles, and joined the Wellbeing Walk Maidenhead in 2023 after your wife of 20 years passed away. Is that right?
That's right.
Currently does 8 of our activity sessions weekly, monthly. An interesting fact, Tony did his first park run in October 2025 and has started to do them on a regular basis. So Tony, thank you for joining us today. I know we haven't got much time, but I was just going to ask you a few questions about your experiences. So how did you find out about us?
Well, after my wife passed, I was walking through my local park and saw a notice about Tai Chi. So I went along to those classes. They were all women, so I was a bit, but never mind. So one of the ladies there introduced me to the Wednesday walks, which I started, and it blossomed from there. So yeah.
And what reasons were you looking for an activity?
Well, I didn't want to brood, so I wanted to get out a bit and see if and to meet people perhaps, and that's what I did. So I've got lots of friends now.
Yes. And what do you like about the activities we run? Why do you keep coming back?
Well, I get out in the fresh air a lot, and I meet lots of interesting people, and yeah. Chat a lot. I certainly talk more than I used to, because I used to be a bit reclusive, shall we say. But now I'm a bit of a conversationalist at times. So, and I like listening to other people's stories as well.
So have you seen any other changes in yourself at all?
Well, yes. I mean, the exercise class are certainly can be a bit invigorating, and I was my garage door's a bit stiff, so with getting a little bit stronger than I was. I mean, I wasn't that bad in the first place, but I sort of heaved I gave my garage door a bit of a shove and dislodged it. So so I had to find out how to get that to come down again because it's stuck.
And yeah, and you were saying about some of the new connections you've made.
Yes, I've one of the chaps is actually a philatelist himself, but doesn't join societies, which I'm a member of about 4, I think. So yes, so we have a chat about stamps on our way round sometimes.
Yeah, and we were talking about your blood pressure.
Yes, I don't think it was too bad. It was a bit higher than it certainly is now. I mean, I took it this morning. I was down to 125, I think was my second readings. And I'm quite pleased with that because the past few days it's been a bit high, but then suddenly I haven't done anything for a couple of days and it's really gone down.
That's changeable. Advice to anyone that's looking to get involved with sessions?
Oh, definitely do it because it's fun for a start off.
Yeah.
And we don't walk fast. I mean, if someone's having trouble keeping up, we just slow down and wait for them. So everyone, and you're out in the fresh air, getting plenty of exercise. Fresh air is good for you.
Yeah.
Especially these days.
And lastly, how was your first park run?
That was fine. I was with Kathy and we she started off at quite a pace. I wasn't going to run. I just wanted to walk, but but I managed to keep up with her. So yes, and I think the next time I did a bit of running, but just I walked and ran. So certainly I improved a bit there.
Okay. I know we're short of time, so I've just said thank you very much for Tony to come along today. I've seen so much improvement in terms of confidence and fitness in you as well. And I would say as being a participant in our sessions, you bring a lot to our sessions as well. So you make it a really good environment for other people. You identify people to kind of bring to our sessions, and certainly some of the kind of back to sessions. You're always taking pictures, aren't you, of the walks and sharing them on WhatsApp with the group. And you've even been my back marker on the Ramblers Wellbeing walk, so that I can't convince you yet to be an assistant walk leader.
I've done that to like you as well.
And so that really kind of helped me evolve kind of the Magpie Meetup projects and kind of inputted to that. And I'd say the other overall kind of learning is, I would say, in the last few years, is making sure the activities we run, that keep people involved at whatever stage they are. So from kind of the befriending coffee morning meetups, and after kind of walks, people sometimes just come to meet us for the coffee, to kind of the back to sessions, and then kind of the regular sessions, and even exercise, even kind of competitive levels in terms of our walking football offer. It's really important, and we found how important it is to have all of those levels, because a lot of our participants move between those levels up and down, and we're always there as a community when they need us. So thank you very much for listening to the three of us. I'm not sure we've moved the slides on, so I think our details at the end. Thank you. But yeah, if there's any questions or anything, please just follow up with us on those. Thank you.
Thank you, Helen, Angela, and of course, Tony. You can see where that lived experience all comes to life. I'm going to hand quickly over to Kirsty because we've got 3 minutes left, and I was meant to give her 15 minutes, so I do apologise, Kirsty. But there's your challenge now to get that in. Thank you so much, everyone, for the case studies and sharing that, and then we'll finish with Kirsty.
Thank you. Thankfully, I'm not one for lots of words. You'll be pleased to hear. But yeah, thank you to both Debbie, Helen, Angela and Tony. Great insights. Thank you. So yeah, as we enter the final part, I just wanted to spend a couple of minutes just reminding you of some GBA resources that we've got. The first one is our foolproof cards. 6 cards, has 1 exercise on each that are designed to build strength and balance. And they're really great. They're kind of built so they can be dotted around the home. They're quite robust. And they're just, yeah, they're kind of sort of friendly in their design. You'll be able to request a batch of those in the feedback form if you'd like some. The Live Longer Better Resource Hub is essentially a page on our website. So you'll find, as I've already mentioned, all the recordings, well, a mixture of recordings and presentations from previous webinars on there. So feel free to take a bit of time navigating through that. And then the last one, if you click on again, Peter, please, is our active medicine programme. And this one links really well to the kind of healthcare professional kind of conversation thread that's been going on throughout the webinar. So this programme was born out of that insight. So if you click on again, Peter, it should, thank you, that's it, keep going. Yeah, so this programme was born out of that insight that talks about people are more likely to change their kind of physical activity behaviours if they're told to do so by healthcare professionals. But in parallel to that, healthcare professionals don't feel confident talking about physical activity. And so our active medicine programme is designed to try and kind of combat both of those things, essentially. That top one there on that kind of little list on the right hand side is our 1 hour online workshop that is purely about physical activity, what it is, what the benefits are, what the guidelines are. It introduces some conversation skills that you'll be familiar with from things like MEC, but it also has a signposting section. So that particular training, it's free. It's for any resident facing role, but we do kind of target it at healthcare professionals as well. The second one on that list is basically an extension of that kind of 1 hour one, but it's 5 modules. So the first module is the 1 hour kind of workshop. We talk more about behaviour change theories and motivational interviewing. So we've recently, for example, worked with some colleagues at the Royal Berkshire Hospital. So that one is kind of, I guess, for those more in-depth kind of conversations. And then there is a Live Longer Better kind of course that was developed by Sir Muir Gray and colleagues. That one's self-led and online. Apparently, if you do it all in one go, you can probably get through it in about an hour and a half. And that looks more specifically at those kind of ageing populations. Again, we've got access to some codes to that for free. So if you're interested in that one, drop me a line. Next slide, please. Main thing to say here is feedback really helps. If you can scan the QR code. Kate, this is your moment. Pop the link in the thank you in the chat. It will literally take you 2 or 3 minutes, but like I say, it's your opportunity to request the foolproof cards. It's your opportunity to request kind of a follow-up conversation, whether it's about active medicine programme or maybe how you're thinking about embedding like the We Are Undefeatable app. And it also helps us shape future events. If you've got any particular burning topics you'd like us to look into, please do. We will send the slides as a follow-up. I'll check all the links and everything. And we'll embed the recording in our website and also send you a link to that. But other than that, thank you very much for your time. That was a very quick whistle-stop tour at the end there. But yeah, thank you for joining us. Thank you to Peter and yeah, Debbie, Angela, Helen and Tony. Thank you so much, everybody, for your time. And it was great to see so much interaction on the chat as well. I think that's the most we've had. So that really helps keep the energy up. So thank you. And enjoy the rest of your days. Thank you. Bye.
Thanks, everyone.